Hello, everyone. My name is Chioma Eze, and welcome to A Better Health. A Better Health is an ongoing talk show series that discusses the most plaguing issues affecting the African community. If you are interested in learning more about health and how it can help you and your loved ones, please stay tuned because I have a lot of good information for you. If you aren't, and if this is something that does not interest you, that's perfectly fine. I will have no hard feelings, even if I love you, but please kindly leave. Health is one of the most vital aspects of any human being and society, yet it's often an overlooked topic. The African community is particularly plagued by many health challenges. I, Chioma Eze, am looking to change that. A Better Health is committed to providing the most accurate information to better inform the everyday person on how to manage, treat, and prevent health issues discussed. I hope that you will join me in awareness. Stay tuned. I am so excited to announce who my special guest is here with me today to discuss all of the amazing things about hypertension. Here with me, I have Dr. Mark. Dr. Mark is a New Jersey native. He went to medical school at Hahnemann Medical College, which is now Drexel University in Philadelphia. He completed his internal medicine residency at the Ochsner Clinic in New Orleans. He then completed his cardiology fellowship at St. Michael's Medical Center. He then opened up his own private practice, which is affiliated with the Raritan Bay Medical Center in Perth Amboy, New Jersey. He then became a medical director at Roosevelt Care Center in Old Bridge, New Jersey, which is a skilled nursing home facility. His practice now focuses on preventative and diagnostic cardiology, hypertension, and heart failure. He also is a resident in teaching rounds.
Thank you, Chioma, and it's a pleasure to be here, and especially a pleasure in this inaugural version of A Better Health. And all the luck to you in this historic day in this historic city.
Thank you. Thank you. So why hypertension? Why are we going to spend the time talking about hypertension? So before we get into things, I am from Nigeria, so I'm very, passionate about being here today and sitting here with Dr. Mark and sharing this. So Nigeria is the most populous country in Africa with more than 170 million people. It is a nation made up of more than 250 ethnic groups, 380 languages, and a diverse range of cultural beliefs. There is an inadequacy in the programs designed to address the numerous health problems in Nigeria, and it's led to little improvement. Life expectancy at birth in Nigeria right now is 46.8 for men and 48.4 for the women. The first WHO Global Status Report on Non-Communicable Diseases listed Nigeria and other developing countries as the worst hit with deaths from non-communicable diseases, such as cardiovascular disease, cancer, diabetes, chronic respiratory diseases, sickle cell anemia, asthma, stroke, obesity, hypertension, and mental health disorders. So given that, in there I said hypertension, and that's why I really wanted to focus on that today. So Dr. Mark, what are vital signs?
So vital signs are a measurement of the body's function in a way that doesn't require any invasive means of testing, and it gives a general overall picture of a person's health. What are they? There are four. There's a person's pulse, which is the calculation of how many heartbeats a person has per minute. That's generally done by feeling a person's pulse, very easy to do. Taking a person's temperature, which we've all had done about 2,000 or 3,000 times during this pandemic. Third is your rate of breathing, what's commonly called the respiratory rate, and that's just measuring how many breaths a person takes per minute, usually in a sitting position. And fourth and lastly, and this is what brings us here today, is blood pressure, generally measured by a cuff around your arm in a healthcare provider's office or at home.
So for today's purposes, we are focusing on hypertension. So for all of those who don't know, what do the numbers mean?
Okay. And just to preempt that, hypertension is the measurement that we take when one measures blood pressure with a blood pressure cuff, again, in the doctor's office or at home. And it reflects the pressure generated by each heartbeat as it's reflected in your circulation in general. Hypertension is manifest by a number that's normal than higher. What is normal? Well, you have to think of hypertension in really two numbers. There's a systolic number, the top number the doctor or healthcare provider tells you about, and there's the lower number, often referred to as the diastolic number. So both those numbers are important, equally important. As one ages, the top number becomes a bit more important. The top number reflects the force the heart generates against the walls of your arteries. And that's measured again by the blood pressure cuff. When the heart relaxes and takes a breather in between heartbeats, you then measure the diastolic pressure. And this is what the healthcare providers are doing when they take your blood pressure. This is what some of these automated machines do when they check your blood pressure. The machine sort of senses when your heart's beating and when it's not beating, takes those two numbers and gives you a systolic and a diastolic. So what is normal? Guidelines have changed over the years. The most recent guidelines have come out in 2017, formed by JNC7, which is a compilation of a group of cardiology, internal medicine doctors who have established what normal should be. And that normal is generally less than 120 systolic, the top number, and generally 80 or less diastolic. And that would be considered a normal blood pressure. Let's now just include a fact that I think is going to reflect the rest of our discussion. 45% of the US population is affected by hypertension. It is a huge number. So how do we determine then what hypertension is? Well, we have stages of hypertension. And according to those stages, we either treat or not treat. So the next stage after you have normal blood pressure, which thank goodness if you do, that's a great thing. But let's say you go in and your blood pressure is somewhere between 120 and 129 systolic on the top and less than 80 on the bottom, the diastolic. Well, that would be considered elevated blood pressure. Notice we didn't use the term hypertension yet. So elevated blood pressure is something that carries with it a risk of developing hypertension in the future, but it's just a bit of a red flag to let someone know that maybe a few lifestyle changes are in order, and we'll talk about those in a bit. We'll actually talk about them at length, I think. And
we will.
Right. And it generally merits getting your blood pressure checked every 3 to 6 months following that. So let's go beyond elevated blood pressure into stage 1. And now it's called hypertension. Stage 1 hypertension would be a blood pressure systolic, the top number between 130 and 130 on top. And the bottom number would be between 80 and 90 on the bottom, the diastolic blood pressure. Let's go one step further. Stage 2, hypertension would be a blood pressure equal to or greater than 140 and a diastolic blood pressure, a lower number equal to or greater than 90 millimeters of mercury. Now, it may not be so important to remember all these numbers specifically. That's the job of your healthcare provider. But it's important to know that they exist, and we use those to determine whether someone should be treated or not, whether someone should employ lifestyle changes or not.
Okay. Now, based on your experience, how does someone usually become aware that they have elevated blood pressure or hypertension?
It's a great question because someone might not be aware of having hypertension at all. We've all heard the term that hypertension is a silent killer. And in fact, Hypertension causes about 7.6 million cases of premature death worldwide annually. And most of those actually occur, 80% of those are in lower to middle income countries. But that having been said, the hypertension itself may not carry any symptoms with it at all. In later stages, hypertension can cause a certain amount of blurred vision or headache, sometimes some nausea, sometimes a nosebleed. Those are rather nonspecific symptoms, but they can point one's direction to look at whether hypertension is a cause or not.
What are ways that I can become proactive to help mitigate further complications from that?
Okay, so then let's talk about elevated blood pressure. We're not even hypertensive yet. So that generally would not require any medical treatment per se. No need to get out the prescription blanks yet.
Good.
but you might want to consider some lifestyle changes. Let's go over those. Physical activity, 30 minutes a week, 5 days, 30 minutes a day for 5 days a week. Great thing to do. Following a heart-healthy diet, fresh fruits, fresh vegetables, low in sodium, high in potassium. Let me ask you, what might some high potassium foods be?
Some high potassium foods would be spinach, oranges, bananas, I believe apples too. I think apples, I could be wrong. Do you mind correcting me if I am wrong?
Yeah, no, those are all yogurt. Actually, is plain yogurt, not yogurt with tons of sugar in it. Those are all high potassium foods.
Okay.
The other things that you can do, I know you don't smoke. I can't imagine anyone who does these days, but let's lose the cigarettes.
Yes.
And manage stress also.
Oh, stress is huge, especially in this country.
Correct.
That's a very good point.
Right. And you know, one might consider life having normally a bit of stress in it, but managing that stress is important. And good sleep habits are also important.
Okay.
You know, there are many curt expressions, Rome wasn't built in a day. I often tell people in the office, I say, look, you do not need to lose this amount of weight. You don't need to do this amount of exercise on day one. For instance, the refrigerator breaks at home. Okay. So you go out and get another refrigerator. But on the way home, you don't stop and buy a dishwasher and a new stove and something else. No, you just do one thing at a time. And that's the way life should be. Correct.
Yeah, I agree. I agree. So I have a burning question. Is hypertension preventable?
To an extent, yes. There are some thoughts that there may be a genetic component to hypertension. There are some studies to show that it is, and some studies to show that it isn't. However, there are some risk factors that you can reduce to keep you from developing hypertension in the future. What are those? Well, if you have diabetes, and 6 out of 10 people with diabetes have hypertension, you can help yourself by controlling your diabetes as best you can with your healthcare practitioner. If you're smoking, absolutely stop. If you're overweight, take care of your diet. Start exercising a little bit, even if it's a walk around the block. The heart-healthy diet, I think, probably is paramount here. And we'll touch on this in a bit, but I think the reflection of low salt and high potassium is probably one of the things that we can do that doesn't cost anything. It's just a matter of educating oneself as to what the proper foods are.
Yeah. And I don't, so he's actually talking about the DASH diet, right?
Correct. DASH diet stands for a dietary approach to stopping hypertension, or to stop hypertension.
Yes. So, and I will put it up on the screen as well. But what it is basically is it helps to lower your So these type of foods help to lower your bad cholesterol. So it says to eat a diet that is high in like fruits and vegetables, whole grains, fish, poultry, beans, nuts and seeds, and vegetable oils, and to limit a diet that is high in fatty meats, full fat dairy, sugar like soda and cakes and ice cream, which is all the, good tasting food, sweets such as candy, and your sodium intake. So incorporating, what this DASH diet into your lifestyle to either prevent it or to manage it if you do have it, is definitely important.
Correct. I mean, essentially it boils down to watching all the good stuff and eating all the healthy stuff. Now, you may wonder why this bottle of wine is sitting here in the middle also, but that's...
It is red wine.
It is red wine, which we recommend, but that's also another big risk factor that you can eliminate to control hypertension. Now, it's here because the general accepted allotment for a male would be 2 drinks a night. And for females, it would be 1 drink per evening as a way of consuming a reasonable amount of alcohol without it contributing to hypertension and a lot of other things that go along with excess alcohol also, heart rhythm disturbances, liver disease, etc.
Okay. What are some things that hypertension can lead to if not treated?
Okay, so having high blood pressure carries risk of things that manifest themselves in other parts of the body. Okay. And let me preempt that by saying why do we even bother with worrying about these other risk factors? Well, because again, they're a paramount problem. How paramount? Well, if you add up the annual cost of the medical expense associated with hypertension in the United States, it totals, again, annually about $131 billion. Billion with a B, and lost productivity amounts to something like $25 billion. And it's anticipated by the year 2030, Chioma, that the cost of taking care of hypertension in the United States will elevate to somewhere between around $343 billion. So it's really a huge, huge problem. The risks associated with having hypertension, and again, for all the reasons that I said, it's a paramount problem. It increases the risk going forward of coronary artery disease. It increases the risk, especially of stroke, which is
that's a biggie.
You just don't want that.
Yeah.
It increases the risk of kidney disease going forward. It also increases the risk of heart rhythm disturbances, especially atrial fibrillation, which turning on the television now you hear a commercial every other day. There's also associated with early mortality, early death with hypertension. And some studies have suggested that even the development of dementia is associated with hypertension. So all these things can be eliminated, hopefully, by awareness, which is why we're here today.
There we go.